Welcome to Open Source Health. I'm Tripp Johnson, founder and social entrepreneur who spent the last decade trying to make healthcare a little more humane and accessible and a lot less soul-crushing. This show is about the real work of changing a broken system, from policy and strategy to using technology and AI in ways that actually help people. Whether it's intake forms, care teams, or back-end systems, we're digging into how healthcare can be built for real-world impact. Glad you're here. Welcome back to Open Source Health, where we explore the intersection of personal growth and changing a broken system. First up, I'm going to share a little bit about what it's been like to practice Ashtanga yoga while being in Spain this month, what it means to find rhythm, discipline, and community, even in a completely new environment. It's a reflection on personal flourishing and how those daily anchors shape the way we show up and work in life. Then for our main segment, we switch gears and dig into healthcare transparency. We're unpacking machine-readable files, what they are, why they matter, and how we're starting to pull insights from them to build a simple but powerful MVP. If you've ever wondered what's really behind the price of care or how we might make those numbers usable, this one's for you. And as always, we'll close with something personal, an anecdote, quote, or something that just stood out this week. Here we are. What's going on?
Wrapping the week up, man. It's Friday here. Late Friday for you too, I guess.
9:51 p.m. here in España. It's
Yeah.
fine.
How's the week been, man? I love your pictures right now. Everything's like it makes me jealous. I feel like I'm the only
Yeah,
loser not taking
it's
vacation right
been
now.
it's good. I mean, there's like so much to unpack around like what, the shortest version of some of this would be, I didn't take much time off when my kids were born. I think because of that, and my wife bears most of the burden. This has been a really interesting learning experience for me,
Yeah.
just around like being a more equal partner on the home front, and then just like the challenges of kind of daily life and the rhythm of having like kids when I'm not usually as exposed to it. And now my parents just got here a few days ago. So it's been, super interesting to kind of be on vacation with them. We haven't done anything like this, in a long time, especially, in another country. And yeah, so it feels good, like working, hanging out with the old folks and then the babies a lot.
How are the kids handling it? I mean, are they aware of like
Honestly,
it?
I think they're great. I mean, I
Yeah.
think this is like, I don't know yet, but I have a feeling this is going to be one of those like, yeah, this is like, if you can do things like this, like it
Uh-huh.
may make a lot of sense. Yeah, we've had one of the big reflections is like, we have way too much stuff. Like the kids are I think happier than ever and they have like nothing to play with. Like we
Yeah.
just go outside and we play in these like rudimentary parks that don't have like really fancy stuff and we run around and we explore things. We're also in like a big city, right? Like this is the
Yeah.
third biggest city in Spain, so it's like very different than living in, the People's Republic of Carborough.
Fair. I'm kind of curious. What's l- what's your Ashtanga and yoga practice been like there? Because I mean, your morning
Yeah,
pictures always look really cool, but I'm
yeah,
pretty curious actually.
yeah. I would also love to do a deep dive on Ashtanga at some point because it's one of the topics on personal flourishing I've been thinking a lot about. But the best way I'll equate it is so one of the things like most of the teachers here don't speak a ton of English. A lot of times it's just run by one person. But long
Uh-huh.
story short, it's a cool physical space. It's like very old school, has all the right vibes to it. And then I don't really get to speak English, but the movements are the same. Everything's kind of the same, so it's just built-in community. Like when you show up, you roll your mat out, like everyone's just there doing their thing. It really, really makes me value the practice just for the sake of like having something in
Yeah.
common with other people around the world more
Yeah.
than the physicality of it, more than the I need to do this or I'm not gonna progress or I'm not gonna feel good or I'm not gonna have
Yeah.
my burn my calories. It's none of that. It's just I mean, it's really cool to just go somewhere else in the world. It's a little different in terms of like I mean, whether you're in Raleigh or Charlotte or Charlottesville or DC or New York City, all places I've practiced plenty stateside, every place has its own vibe and unique, kind of idiosyncrasies to it.
Yeah, yeah,
And then I think it's magnified when you're out of the country and you don't speak the language very well. Um, but then, like, again, everyone's just there doing the same thing. So it's a very welcoming. I think it really has made me much more comfortable in Spain in general and really trying to work on my Spanish. And just like, I have people I know who I can like lean on, right? Like, I thought we had to get we were going to have like an emergency dentist appointment for my daughter. And I was like, not a problem. Like, I'll just go to yoga and they'll figure this out for me.
yeah, yeah,
And like that kind of confidence that comes, I think there's a
yeah.
real confidence sometimes that comes from being in community.
Yes,
And
yeah, yeah.
that's one of the things I really appreciate about the practice, and especially here in Spain.
That's very, very cool. Yeah, I think there's like such a protective variable or protective factor in having community. I know it's like a duh sort of statement, doesn't, so obvious that it probably doesn't feel like it means as much as it actually does. But um, I know for myself, it was, I grew up religious, deconverted, became an atheist, and then drifted around for a little while, like seeking community and all that. And then, when I started training jujitsu and immediately stepped into it, there was this, it was, I had such a very similar feeling to, the safety and comfort I felt at church or whatever, um, just immediately enveloped me. And it was just in reflecting on that, it's completely the community. It's just having this sort of sense of community belonging, connection, and, you know, responsibility for others and to others and vice versa.
Cool.
Yeah. All right.
Well, is it time to get into the main topic?
It's time to get into the main topic, one that you're a lot more familiar with than me.
We're going to have to figure out how to do that better. Sorry. I just had to do it. I don't know if I was supposed to. Yeah. Kylie, fix this for us. Come on.
Yeah.
Come on. We don't know what we're doing. There's no adult in the room.
No. Oh man, that's good. So today we're going to be touching on machine readable files, and I got to admit I don't know very much of anything about this. So I really want to approach this right now as just me trying to extract as much information and understanding from you on this topic, and why it's important and why you started to position us to be prepared for this sort of thing. So, in the broadest, most layman sense that you can, keep us at a fourth grade reading level. What are machine readable files?
I may not actually be qualified to answer this, but I'll tell you what I think they are. So let's just so machine. I'm going to define maybe machine readable files, and then I'll talk about what they mean as it pertains to healthcare. But machine readable files are files that can only be read by a machine because they're just too big. You can't just like open them up and start looking around like it's an Excel document, right? So you have to extract the files and display them. You pretty much have to code in order to pull the useful parts of what you need because they're just these massive data sets as it pertains to healthcare specifically, and whether we call them MRFs or machine readable files in healthcare. A couple of years ago in 2022, I guess it was Congress mandated that all health insurance companies publish all of their in-network and out-of-network rates that
Uh-huh.
they're paying to providers, which basically means like everyone's rates that they're getting paid is publicly available with a giant asterisk that you need like an actual developer to figure out how to read these files. So, and I asked our CTO earlier as I was thinking about this podcast today, I asked him like, were people deliberately making this hard? And he's like, well, it's too early to say that because the government could have also just given like horrible guidance that just said you have to publish all of this, and they left it up to every company to do it themselves. So at this point, we have processed pretty much all of the Blue Cross Blue Shield data from around the country. So this tells us, so like what the so what about machine readable files is like, if you have access to this, you can see exactly what everyone's getting paid by an insurance provider. Now you have to do that for each insurance provider, but that means if I want to know, Johnny Appleseed psychiatry down the road, why are they getting paid more with me? And then when I go in to negotiate rates the next year, I can say, hey, I know you're paying Johnny Appleseed, 50% more than you're paying me. I would like to understand what I need to do to receive that kind of increase, because I would like to do, if this is patient care related and I need to be doing something better, please tell me, because if they're doing this right, help me do it. Most of the time rates are just negotiated kind of one off, and there's a legacy component to it where the longer you've been in network, the more times you've been able to renegotiate. So
Right.
all of this is set up to really just screw over the individual providers, the people who don't have a lot of bargaining power. And we're at a kind of an interesting place where we've got enough patients, especially in our market, that like the insurance company would not want us to not exist in some ways, but we're not big enough to actually like, throw our dicks on the table, for lack of a more professional term.
You were keeping it together so good. So you
I
were,
know.
you had it.
Uh,
You almost stuck the
I
landing, and then
just
you wobbled.
I couldn't. I couldn't. I couldn't. It's way
Yeah.
past my bedtime. So yeah, it's going to be really interesting. We've got a almost working. I mean, we've got a working prototype of what it could look like to put on a website. And there are other companies that do this kind of stuff. Like, we're obviously not the first people that thought, hey, it would be great to use other people's payer data to inform our rate negotiations.
Yeah. How do you see this shifting the overall healthcare marketplace at all?
Well, let's talk about, like, let me tell you like how it's being used currently. So
Yes. Start there.
most people, let's just start there. So most people don't know that this data exists. Period. Like, even pretty big, large, sophisticated people do not know that all of this data is out there. So
Yes.
that's part one. But the people who are sophisticated, who do know about it, are paying a very kind of small set. You either go out and you hire someone to get you the data you need, and maybe a one-off kind of consulting thing, or there are, my guess is there are more than this, but I know of about 5 or 6 companies that provide this as a service, right? So, and one of them is backed by Sequoia, so big health tech company. It's called Turquoise Health. I quite frankly, like, I don't really understand like how their website doesn't tell me anything that I find that useful, or it's not displayed in the way I would want. I don't get it. So it's not, but I may be the idiot, because, Sequoia pretty sophisticated. Um,
Yeah.
but you've got that, and then you've got another one called like Payer Advisors. I know that's one, PAYR Advisors. And then we've talked to some buddies, I won't name them here, or some folks we know, small consulting group in behavioral health that has gotten some of this information for specific, like, residential PHP and IOP codes. Um, and so there again, it's fragmented. But what I'll say is that the people who are using them right now are pretty much large healthcare systems, private
Okay.
equity backed healthcare, and things like law firms who may be like very heavily in the healthcare sector, because a lot of times, you might use your lawyer to negotiate rates, you might use a consultant to negotiate rates, you might do it yourself. So most of this is generally conceived of as around like, how do we negotiate the best rates, how do we know what others are getting paid, because there's like wide variability in that. And it's illegal. Oh, I probably should have started with this. Like, our contract as a provider organization forbids us from sharing our rates with other provider organizations.
How does that?
So the idea was that Congress is like, well, hey, that's not fair. You know what rates you're paying to everyone, but
Uh-huh.
they can't know this. So now they rolled out this price transparency component, and this had other elements of it, but one of the components of it was you have to make this data available, both in network and out of network rates that you're paying to every provider. You have to make publicly available, but they're just in this like crazy format, right? But on the flip side, like to make this easy to look up is an actual like very heavy burden. I think there are from what Albert told me. Albert's our head of engineering, and I believe Albert said there are trillions of rows of data in these files, and that is just for Blue Cross. But that tells you
Oh, yeah,
how complex healthcare is, because it's not just, hey, you're paying this group this amount. It is
yeah,
by every service line, every provider type. So like just for therapy, you could, for Advaita integrated medicine for us, we might have, you know, 20 lines just for the, 90837 code,
yeah.
which is
I
nuts.
dude, can I take like 2 seconds to go on a tangent? Okay, so I am becoming. I hate conspiracy theories so much, right? Uh, with an unbridled passion, I can't stand it. And often it's because you take someone like me that's has no insight or no depth of expertise on some particular topic, and I stand back and I think, man, this thing should be easy to do. I don't understand it. It's just communicating what the rates are, the contracts. And then the second you have any sort of exposure to the actual issue, the actual problem, you realize the depth and complexity of it.
Mm-hmm.
But more often than not, people want to fill in the gaps of their own misunderstanding or lack of understanding or inability or lack of expertise. They want to fill it in with like nefarious things. But at the end of the day, you just trillions of lines of like data that's like insanely complex. There's no nefarious cabal happening with this. It's like ripe for people to say, well, the man wants you to, they want to keep it this way, or they want to. In all reality, it's probably just there's people that work 40, 50-hour weeks, whatever, and they just want to get to their weekend.
Well, yeah, and I think that is so. I agree. I think I I just don't know. I mean, I like again. This is where what I do 100% agree with is like usually complexity trumps conspiracy in terms of
Yeah.
the best explanation. Like you're just not smart enough to understand quantum physics doesn't mean that it's not like there aren't, many universes. It just
Yes.
means like you can't get over that. Like um but the healthcare piece specifically, and I think most of this is just human behavior. Like I would even boil it down to this: is like they're incumbents and they want to protect their advantage, and like that's normal stuff. And the problem is like, and this is what, well, a couple things. That is the problem. There are big incumbents in healthcare, whether you're talking hospital systems, whether you're talking pharmaceutical companies, all of these things. These are massive incumbents that want to protect their, financial viability and profitability, and uh, as we all do. But where there are problems that the market doesn't regulate because the big boys have too much power, like that's why we need effective regulation. But like this is so complex. How could you expect any congressman or senator? It's like when Zuckerberg was up there on, for the Senate hearings, and they're asking, and they're like, well, your algorithm is making people do this, and he's like, well, it's not. I mean, it's not like telling them to do that. He's like, well, that's what I think it is. So
Right.
it's very complex, and I think like this is just a really good example of how like Congress tried to do the right thing in increasing transparency, but they probably weren't specific enough about how they could actually make this useful. And I'm sure there were a lot of people lobbying against this from the health insurance side and everything else. And even big hospital systems or big people who've already cracked the nut of this, like they don't want this to be public information. And quite frankly, like this is where we as a company, I think, are different from your general, like we want to help people flourish. Like at a baseline, that's what we're trying to do.
Yeah.
But I think the extra wrinkle, the macro play that we're trying to make is sometimes that means hurting ourselves. And sometimes, like, in order for us to see what we want in the world, it means we're going to lose some sort of advantage that we could have. But, like, that's what we're willing to do. So in this case, it's like we can process all this information, we can use it to negotiate our rates, and we can tell no one about it. We can monetize it, or we can make this open source, or some combination of all three. But and we're going to make this more affordable and more open source than it is. It may be some sort of freemium type thing, but we're at least going to give people access to some of this, because quite frankly, like when I get offered $60 an hour to join an insurance network for therapy, like, we pay people more than that hourly who do
Yeah.
therapy. Like, we can't survive, period, on that. So I'm pissed. Like, I'm pissed about that, and I'm pissed at all of the people who, if they were guaranteed a rate increase a year later, may have accepted that rate, because we got our rate increase to 110 the next year. But I had to eat shit at $60 an hour for a year. And I want people to, to know what the rates look like and to be able to query some of this stuff and answer questions, because I do believe generally, like, that we can, anytime there's a complete lack of transparency, that specific area is ripe for innovation and disruption, because the truth wants to see the light of day. And I think that's a little bit of, what we're trying to do here on the Don Quixote side of things with this.
I'm gonna try for a second to articulate a thought and see if I can kind of land with it eloquently. But I think there is something to be said for when you're trying to pick strategic directions, right? You can play this game of advanced calculus or something, right? Like kind of trying to control for intersecting multitude of variables, chaos, all this sort of stuff, and anticipate all of that. Or you can kind of decide what your values are, what your north, and let those be your north star, right? So you have your values. What is it that we're actually interested in? And I think we've done a really good job as a company, really nailing what it is that we're interested in and how do we do that, right? Like, and so that becomes our north star. So there's no like debate over, is this going to hurt us in the short term? Is this, hurts us long term? Like if we get fixated on those at the risk of trying to do what we perceive to be in alignment with our values, then we're always going to be chasing our tails or fighting ghosts or just swinging wildly. And I think there's something very calming and focusing and orienting about saying these are our values. This is what we understand our values to be, and this is the work and reflection and that we've done to arrive at them. And so now those become our north star. That guides what we do. We don't have to figure this other stuff out, and frankly, we couldn't figure it out anyway, right? But we can figure this out, and we allow that to dictate and guide what we do.
Uh-huh.
Yeah.
Yeah, I
Helps
mean,
filter.
wait, while you were saying that, I've been looking for, because, like, I can understand why anyone who is an executive or, wants to increase their collections, why they would be very interested in these files. One of the interesting pieces, though, because of, something I'm hoping to show in data over, it may take a few more years. I like to think we kind of pay top of market for our providers, given the, constraints of insurance care. Um, like a real benchmark, I think, in the future is what percentage of reimbursement is going directly back to providers, and different provider types. And so, if you're getting paid twice as much for the service and you're paying people just slightly more, are you really putting your providers first, or do you have the big bloated administrative overhead? Are you just raking in the profits? So there's this, I am obsessed with fairness. And I think, to your point, like, having to find kind of the North Star that we want people to flourish, and that we're not going to shy away from the complexity of what it takes to do that. and what we need systemically. Like it starts to clarify, you know, what you can do, what you can look at, what you can build. So who knows? And this could be
Yeah.
our foray into the software world. I mean, we should have the MVP demo next week. So Butler, Elena, and Albert are going to be demoing that to us next week. Should be pretty exciting.
That's very, very cool. Yeah. I think we'll probably have some follow up or something with that. I would hope, right?
I mean, I think we should. And if anyone's interested in, learning more about this or hopping on, shoot us a message because
Yeah.
we're not sure. I was just talking to a buddy of mine who left a C-suite position at at least $1 billion, maybe multi-billion-dollar healthcare behavioral health company, and I was talking to him about this specifically, and he said, most people don't even know this exists, and for us, we paid ten. I negotiated the contract. We paid $10,000 per year per state of data that we wanted. So you're talking like if you wanted all 50 states, it'd be $500,000 a year for one company to access this. So you start to see like there's a real opportunity in charging half as much.
Yeah. Yeah. I mean, that is the fun thing about being like this eccentric star, like where I mean, smaller, eccentric driven sort of thing is like, yeah, we'll take half. Like half would be a windfall for us. That's great.
Yeah.
Yeah.
Oh
Oh
man.
man. Well, cool. Any closing thoughts or anything on that before we start to wrap?
No, I think I just wish I my challenge I think to everyone, myself included, is to look for how protecting your personal interests comes into conflict with the values that you've articulated because like at the end of the day it has to, and ignoring that doesn't make you a good person. It makes you naive and simple-minded. Or, I shouldn't have said that, but you get the point. Like living by your values requires sacrifice, and you just got to do things for the greater good. That was awful, but those are my closing thoughts. Like we have to, especially in healthcare, we got to get beyond the platitudes, and we've got to start doing the work that makes things better. And that is oftentimes, if you're an entrepreneur, if you're an executive, doing the right thing by patience means that like your life's harder, and that's how it should be if you're actually living aligned with your values.
Yeah, I mean, I know you just kind of discounted yourself there a little bit. I mean, maybe that felt trite or something like that, but I actually think it's a remarkably important message right now. Not even just pertaining to the healthcare industry or anything, but just generally speaking in life. Like, um, without swerving too much into politics or getting too specific with anything, I think the cognitive dissonance that I watch people sort of unwittingly tolerate in themselves is truly baffling right now to me. And a lot of like people that had allegedly had some sort of principles guiding their political orientations and cultural orientations and practices, and having watched all of that disappear for short-term gain is what you're essentially articulating there. I think both applies to healthcare, business, the topic we're talking about, but also broadly and culturally. Like this, no one,
Mm-hmm.
you're never going to be happy if you're living in this cognitive sort of dissonance. You'll never flourish as a human being. You'll never be satisfied. You're constantly going to be at war with yourself and actively resisting yourself in some sort of capacity in a way that I think is just ripe for suffering. And you just don't have to do it.
And if you have insight into non-duality, you can escape this need to prioritize others as opposed to yourself. But
Yeah.
that's for another day.
All right.
All right, Marcus, I think you're going to hit us with a quote you found impactful this week.
Yeah, I'm a huge Brad Stulberg fan. Follow him. I actually haven't read very much of his stuff, but I find him to be a very clear, remarkable thinker. And something I'm very, very big on right now is healthy representations of masculinity, because I think it's just at such a deficit culturally right now. And so I think he represents that super well. Intellectual thinker, weight trainer, father, all the good citizen, values those sort of things that I would call like the ancient Greek classical ideas. And so I wanted to share something I think that was really sort of helpful for me. I think I'm always someone in my role and really generally speaking in life that because my curiosity is always pulling me into the being over my skis and trying to manage that. And so I found him to be someone like that's a good salve for me when I'm distressed about something. But he this week he shared a nice little writing that's very short, but he just simply said, best diet is the one you can stick to consistently. Best exercise program is the one you can stick to consistently. Best routine is the one you can stick to consistently. Best deep work is the kind you can stick to consistently. I think if I'm not careful, it's very easy for me to look at everyone else and assume that they're doing better or that their routine or their quote unquote hack is they've figured something out. And ultimately it just has to come down to sort of what is it that I'm able to do consistently, and consistency is what matters.
Yeah.
You will always get better just showing up. May not be optimized, may not be the most efficient way, but just showing up consistently over time will always win.
I'll tie that back into because I'm a huge Brad Stulberg fan as well, and I have read at least one of his books, Art of Groundedness, which I think
Yeah, yeah,
is just a phenomenal read for pretty much anyone. But I think that's what I really enjoy too, like where I've come to with like the practice of Ashtanga. I don't see it as I don't see it as like a spiritual pursuit. I need to do this to get better. At one point I thought like, oh, you've got to do these things right. You'll unlock some state of mind, and then this, and then well, if I get my asana right, then I can do my breathing practice, and then I'll be ready for meditation and insight. And I learned how like ridiculous with what I perceive as insight, how ridiculous all of that was. But then it just brings you back to what really matters and having those routines. Like for me, Ashtanga is the way that I'm most likely to move my body in a way that makes me feel good the rest of the day, that helps regulate a lot of other things. I don't have to focus on optimizing 13 different things. I can just show up and do the same thing every morning. And that in and of itself has been, it just takes a lot of chaos and a lot of decisions
yes.
away from me. And that's like, yeah, the best routine is the one that you're going to stick with. So I'm all about that.
The sun is quite literally setting on you, so you probably need to get in bed, huh?
I think so. I think
Yeah,
so. So, well, I
cool.
think this was a great episode, and my sound bar agrees.